Charcot-marie-tooth disease, also known as hereditary motor and sensory neuropathies, is an entity that was first described in 1886 by Jean-Marie Charcot and Pierre-Marie from France, as well as Howard Henry Tooth from England, thus the name Charcot-marie-tooth disease. It is a disease that causes injury to the peripheral nerves. It affects both the motor and sensory peripheral nerves, and thus manifests as distal limb weakness and sensory loss. The peripheral nerves are the nerves that bring information in and out of the central nervous system, which is your spinal cord and your brain over here. Here you can see a peripheral nerve coming out of the spinal cord. The peripheral nerves are made up of sensory and motor neurons. The sensory neurons bring information into the central nervous system, and the motor neurons supply the muscles of our body. Myelin is essentially an insulator that wraps around the neurons to help speed up the signals that are transmitted through the neurons. Charcot-marie-tooth disease is an inherited familial disorder with many gene mutations identified. Clinically, however, we will focus on 5 important ones. And in each of these cases of Charcot-marie-tooth disease, and enlarge nerve fibers. This is also known as the onion peel appearance. And finally, investigations to order also involve those that will rule out other differentials such as HbA1c for diabetes, vitamin B12 levels, as well as a lumbar puncture to look for chronic inflammatory demyelinating polyneuropathy. There is no treatment that can stop the progression of the disease, and so usually the treatment is supportive, wearing braces to help correct foot drops, orthoses, for example, walking aids such as a walking stick. Sometimes orthopedic surgery is needed to stabilize the foot.